So today we've got the first session of a new series of educational sessions that we are hoping to have put together, and it's called the Patient Journey. And today we've got Sarah Bubb and Liz White who have joined us to talk to us about their own experiences, and they will further introduce themselves as well. But just say in advance, thank you very much for taking the time to do this, and really, really excited to hear your stories and have this new addition to our Wednesday educational sessions as well. So as usual, we are recording the session, and any questions, please put them in the chat or raise your virtual hand up at the end of the session. So if that's okay with you, Sarah, you can make the start.
Many thanks, Nick, and welcome to everybody. My name's Sara Bubb, and I'm a member of the South East Genomic Medicine Service as a patient, so a volunteer. And a big shout out to the two that I can see on my screen. I'm sure there's more, but big shout out to Kerry and Miranda, who are colleagues. Fantastic. I've recently met Liz White through a Sudden Cardiac Arrest UK charity support group, and her story was really interesting. And I thought it would be really valuable to have her along today. So a big thank you to Liz for coming along to share her story as well. I'm aware that some people have heard my story already, so I thought it would spice things up. And our aim today is to give you insight into how important your job is. From our point of view, it's just like amazing what you do. And, you know, you are saving lives. So we just want to give you that perspective and that thanks as well. We're aware that we are very lucky to be alive, having had sudden cardiac arrests. It was originally called sudden cardiac death. And then I thought people might think that we were ghosts coming from beyond the grave. But you know, our hearts did stop. We did die in one respect. The survival rate of people having sudden cardiac arrests out of hospital is really low. It's 8.7% in 2021, which was when both Liz and I had our cardiac arrests. That data comes from the London Ambulance Service, and I think the Southeast Ambulance Service data is similar. So we're very lucky to be here. So we're paying tribute to all those people that didn't make it. So we are really glad to be alive, but on the other hand, it's also quite depressing because we are now living with a lot of ill health. Fatigue is a sort of daily aspect. Probably after this session, we'll both have to go and lie down. The fear of it happening again is really great. And the loss of confidence and independence. I'm a professor at University College London, and I also used to do freelance stuff. I used to travel around the world, training teachers and school leaders all over the place, such as in Myanmar, Norway, China. And now I haven't got the confidence to even go up to London without a real palaver. A lack of independence as well. Our families worry all the time about us, and that is completely understandable, but also really irritating to constantly being tracked where I am, you know, why I haven't returned when I was going to, because for them, you know, our cardiac arrests for both of us came completely out of the blue. So you think, is it going to happen again? We've both now got implanted cardiac devices, which include defibrillators. So if our hearts go into dangerous arrhythmias, like both of us did, they should kick in. But living with a device is reassuring on the one hand, but also a bit terrifying on the other, because you think, oh, what will I be doing? Will I be climbing up that ladder, pruning a hedge when it happens? Will I be crossing Oxford Street when that happens? So yeah, it's quite a big deal, but we are very grateful to be here. So I'm just going to tell you about my story, which started on a lovely Friday afternoon in June in 2021. I was a regular swimmer in a lovely lake in Beckenham Place Park, near where I live. I was going 2 or 3 times a week, absolutely loved it. Was a very confident at swimming in cold water, had swum throughout the winter and on New Year's Day and Christmas Day. So nothing untoward there. I was perfectly fine that day. At lunchtime, I'd taken the dog for a walk into woods for about an hour and a half and only saw one person. It could have happened there. But I was in the middle of the lake, and all of a sudden I felt this lack of power and thought, oh, something's wrong. And you're meant to swim around the lake in a clockwise direction. And I was right in the middle of the lake, completely out of my depths and away from any of the banks. But you have to, in this lake, you have to wear a float. And luckily, I grabbed onto the float and managed to sort of doggy paddle my way to the edge. And the lifeguards knew me as a regular swimmer and spotted me. And I'd already got to the sort of the muddy bit. I was able to put my feet down on the ground when they saw that I was in trouble and helped me get out. My notes say that at this stage I was in peri-arrest. So my heart was going into ventricular tachycardia. But the symptoms were that I was really breathless and weak. I could say a few words and then wasn't able to speak at all, just sort of shake my head or nod. But the lifeguards were totally brilliant. They got my bag and phoned my husband. They called the ambulance. They cleared the lake. The lake in Beckenham Place Park is right in the middle. And it was a sunny Friday afternoon to about 4:30. So it was amazing that the ambulance got there in time for me. I don't have any recollection of what happened. After 999 asked for the postcode of the lake, and the lifeguards didn't know it, but I did, and I was able in my last dying breaths to give them the postcode of the lake. Weird mind. And after that, I don't have any memory. But my records say that my oxygen levels when the ambulance crew came were only 59%. They blue lighted me to Lewisham Hospital, which was the nearest one. And then they worked on me, tried various things, CPAP, BiPAP, various things to help me breathe. And then I started going into arrest. I'm getting all emotional. They had to shock me 3 times to get me back. So amazing. Well done, Lewisham Hospital. So yeah, a very tricky time. I was eventually intubated. In fact, I think I'd already been intubated when I went into cardiac arrest, but they then transferred me to King's College Hospital in Camberwell, where I was in intensive care and in induced coma for 3 or 4 days. They kind of take you out gradually from that. So what a palaver. This is somebody I've never been ill. I'd had 3 children, 2 pregnancies because my second pregnancy was twins. I'm the person in my family who's always well. So I'm just taking control, Nick. So I was diagnosed in hospital with dilated cardiomyopathy. And this is a disease of the heart muscle, which makes the muscle walls become very stretched and thin. So they're dilated. So the left ventricle becomes like a big saggy bag. So the walls are very weak, which means that the heart can't pump out blood very efficiently. I also had left bundle branch block, which is an electrical issue, and it's left me also in heart failure. So the symptoms of these things are that I get very tired, puffed out. I can walk on the flat fine, but going up any inclines, I'm puffing. I was active before the cardiac arrest, and I continue to try to be active, but at a lower level. But I walk, try to do my 10,000 steps a day. I do Tai Chi, various other things. But if I don't sleep for about 9 hours a night, I'm fit for nothing. I had an implanted cardiac device. Mine was it is called a cardiac resynchronization therapy device. And that paces my heart about 97% of the time. I never like to ask what happens the rest of the time. It sits just under my collarbone. So it's quite a sizable lump, but I'm used to it now. I went through family history when I was in King's, and there were no heart issues in my family that I know of. My parents, very long lived, died at 89 and 94, knew of nobody that had heart issues. So they didn't think it was genetic. They thought it was probably viral, or maybe even to do with the COVID vaccine. Remember, this was 2021, so we were still very much affected by lockdowns, people wearing masks, etc. I had no symptoms of having a virus. So all my 3 siblings and my 3 children had screening. So they all had an ECG and an echocardiogram. My siblings were fine, apart from one brother where they found he had atrial fibrillation. And my 3 children were, one of them was very quick off the mark. He went to CRY, the charity CRY that screens for cardiac risk in the young. He went there. My daughter went via the GP. I was given no letters for my siblings or my children to take to anywhere. They just had to tell people, their GP or hospital, that they'd been asked to have this screening. My daughter's result just disappeared. And in fact, she phoned the GP and the receptionist said, "Oh, if you haven't heard anything, it's fine." I'll tell you a bit more about that later. My eldest son has only recently-ish had his screening, and luckily it was fine. He's now got a baby who's 1 year old now. My brother has 2 children, and his daughter has 2 little girls, but she has also produced eggs for her brother, who's gay and wants to have children with his partner. So she has produced 13 embryos, which is why I've put a question mark there. And that was a particular concern for me about the possibility of any genetic reason for having dilated cardiomyopathy. I think about 40% of people with dilated cardiomyopathy find that there is a genetic cause. But genetic testing was never mentioned in hospital and wasn't mentioned for over 2 years. I got interested in it because I went to a talk by Tuti Bouza at the South London Cardiomyopathy UK support group in April 2023. So that was nearly 2 years later. And that encouraged me to mention it to the GP. I don't know whether she did anything with that or whether it was set in motion. But I had an appointment with the consultant cardiologist, Dr. Steriotis, at the Princess Royal University Hospital in July, August of 2023. And he referred me to Liz Wilson at King's. So I then had counselling for genetic testing, which I personally found a little bit sort of over the top because I thought it's a no-brainer. At this point, I was thinking, I'm pretty sure there isn't any genetic reason for me having dilated cardiomyopathy, but it would be good to sort of check and rule it out. That was what I was thinking. So I had a phone call with Liz and then met her because I had to sign the form in person. I'm just raising these things because I think things have improved since 2023. But for me, it seemed to slow things down unnecessarily. I had the blood test to take the DNA on the 14th of September. The people in the blood test clinic didn't seem to know what to do with it, which Liz had warned me about. So everything was on the envelope to send it off to Guy's. And then I got the results nearly 6 months later, on the 3rd of March. And in that 6 months, I heard absolutely nothing. And I didn't even know whether the blood test had actually arrived at Guy's to be forwarded. And it was only at that day when I met people like Kerry and my colleagues in the patient group that I went round the laboratories at Guy's and talked to people more about genomics, that I thought, you know what, I'll just email Liz and see if there's any news. That was on a Friday. And bless her, Liz responded because the result actually came out on a Sunday or in the early hours of a Monday. I remember getting up in the middle of the night to go to the loo. I just looked at my phone and saw that there was a message from King's to go onto the King's app. So I went downstairs, loaded up my laptop, and got the results. It was amazing. But over that 6 months, during which I had heard absolutely nothing, my feelings changed and the anxiety increased. And stress and anxiety are not good for anyone with a heart condition. They're not good for anyone, full stop. And the things that increased it was that my daughter's echocardiogram result, she didn't hear anything. She contacted the GP, as I'd already said. They were saying, if you haven't heard anything, don't worry, it means that everything's fine. Eventually, I raised it with Liz in the inherited cardiac conditions, and she tracked it down and found, yikes, after 11 months of not hearing anything, we found that she had mildly dilated left ventricle. So I was thinking, panic. Maybe it is a genetic issue, and I've passed it on to my daughter. My 3 kids are in their 30s, thinking of having children. My daughter's a twin, so the chances of her having twins are also quite high. And I'm thinking, yikes, she's got a heart condition. Because she wasn't a priority, the MRI to get further information took quite a long time, probably another 6 months or so before she got the MRI. And actually, they found that everything was okay. But during this time, I was worrying. My niece also fainted out of the blue and then had a whole series of heart tests. Her husband had private health insurance, so she had a battery of tests very efficiently done. But she was contacting me after every one, and, you know, it just kind of upped the ante. I remember that Christmas, we were all sitting around a big extended family lunch, just talking about heart issues and the what ifs. But then I got the result in March, and woohoo, it was negative. So I took that photo the other day of the forsythia poking through the wall. And this is wording from the actual report. So the analysis did not reveal any genetic changes in the genes associated with dilated cardiomyopathy. This was almost all that was on the letter. And I started reading a lot into it. So it says a negative result does not change your diagnosis or rule out an inherited cardiac condition. So I was thinking, oh, am I really safe now? And then it said, I still recommend your first degree relatives to complete clinical screening, inclusive of an ECG and echocardiogram. So I was thinking, yikes, why are they saying these things if everything's all right? Have I got something to worry about? And I'm just sharing that because it might be useful for you to know. Sorry. I'm now going to pass over to Liz, and I'll press your buttons, Liz.
Thank you. Thank you very much, Sara. You did well. It's hard talking about our experiences. Always brings up quite a few emotions. So I'll give it my best shot to follow you.
Liz, can you speak up a little bit?
Okay. Thank you very much for your talk, Sara. It is emotional talking about our experiences, so I'll do my best to follow you as well as I can. I'll start with, I am so grateful, can you hear me now? To get genetic testing, and would like to explain why. From the age of 16, I started having prolonged faints that resulted in a fit or a seizure. They seem to happen on average about once a year, sometimes more, sometimes less. I had many hospital visits, and unfortunately for me, I've visited all the hospitals in the southeast of the country at one time or another. But I briefly was diagnosed with epilepsy, but after a short while, a neurologist decided that that definitely wasn't possible because I would go very pale and epileptic patients go bright red in the face. And he eventually diagnosed me as having vasovagal syncope. And I was told it's not dangerous, but nothing more can be done for you. Fortunately, though, my blackouts, as we called them, seemed to resolve themselves when I became pregnant in 2002. But they came back with a vengeance in 2016 when I collapsed while mooring a barge we were on holiday on. The following year, I was pulled out of the sea unconscious in France, and once home, investigations resumed. I experienced worsening symptoms and sometimes felt like I was being switched off. So I'd be walking along and get slower and slower and being almost unable to put one foot in front of the other. But I was lucky enough that both bradycardia and tachycardia episodes were detected on a 7-day Holter test. Up until that point, the doctors were dismissing me because of my age, because they realised I was suffering from sick sinus syndrome, which they told me normally happens to much older people. And I got fitted with a pacemaker in September 2018 in Margate Hospital. All my pacing checks, I would be surrounded by people in their 80s, so I did find the experience a bit unnerving. And I didn't feel quite right, even though I'd got a pacemaker. So I went to see someone privately in Guildford, a consultant, who identified that I had a problem with the calcium channels and recommended I was put on verapamil to resolve this. Amazingly, that made me feel completely normal, and I began my very active life again. I had retrained in the COVID pandemic, was working for Kent Wildlife Trust, and had started becoming a bison safari tour guide. And I would cycle through the woods and do talks through the woods and around the woods and encourage people to get more involved with wildlife. I went on cycle rides. I'd take my dogs out for walks and swimming and so on and so forth. So it was a bit of a shock to everyone in the family when I experienced a sudden cardiac arrest at the local tip, aged 49. My heart stopped for 6 minutes, but luckily my husband had just done a first aid refresher course and there was a defibrillator on site. That luck saved my life. Kent, Sussex, Surrey and Sussex Air Ambulance attended the scene and put me in an induced coma, and I was taken to the William Harvey Hospital in Ashford. The whole incident was captured on my pacemaker, and very strange heart rhythms were detected in hospital, but nothing conclusive was discovered. They couldn't work out what had caused the cardiac arrest because I appeared to be healthy and fairly young and fit. But they decided in the end that there was a real risk that I would have another cardiac arrest, so they didn't want me to leave hospital without an ICD being fitted. And the decision was taken, the best place for this to happen, because the pacemaker had to be extracted, was to be transferred to St George's Hospital, London. I am so grateful for that decision, because there, while I was undergoing countless tests and angiograms and an adrenaline test to try and make me have another cardiac arrest and all sorts of different extensive tests, I met Katie Frampton and Dr. Spectorman, who were part of the inherited cardiac conditions team. Katie Frampton was the inherited cardiac conditions nurse who was able to explain to me everything. She was like a ray of hope. She told me that there might be a genetic cause for my condition and offered me a chance to get genetic testing. I leapt at the chance. I had nothing to lose. I've been tested for everything for years and years, and nothing really had been able to be done for me. Although she really was careful to explain that they might not find any cause, they could keep my results on a data in a genetic bank, and so if they can't find something now, they could find something in the future. And this was so comforting. I agreed immediately. At this stage, they kindly offered my immediate family, my parents and my siblings, tests, but none of those people took up the offer at that time. I think it was partly because of the enormity of what had happened to me hadn't sunk in. I was still in hospital. I'd been in hospital for 5 weeks by then, and they were also familiar with previous blackouts, which none of them had ever suffered from. So they didn't get tested. I was tested. It's just a simple blood test. It was the easiest test I'd had while I was in hospital. And then I had the ICD fitted and I was able to go home. Once home, that's when the really scary bit started. My heart, despite the pacemaker being there, was behaving extremely erratically. I was put on bisoprolol that made me very faint, and I had, luckily, the cardio rehab team nearby looking after me. I was the only person they had looked after with a cardiac arrest, so their experience of that, rather than a heart attack, was limited. But they did their best to keep an eye on me. The bisoprolol wasn't fixing things, so I had many repeated visits up and back and forth to St George's for my ICD device to be tweaked or to do another exercise tolerance test and be assessed, and my medicines changed. In the end, they put me on hydroquinidine, and that made me feel like I was fizzing on the inside. It was the scariest experience of my life, despite everything I've told you so far. So when I got a phone call from Dr. Spectorman in March 2022, and he told me that I had got an inherited cardiac condition, I was so relieved. It's called CPVT, and its long name is catecholaminergic polymorphic ventricular tachycardia, that causes dangerous arrhythmias, normally brought on by exercise or adrenaline, strong emotions. For me, it's quite often anticipation of doing something. Immediately, Dr. Spectorman changed my medicine and took me off hydroquinidine and put me on nadolol instead, and then introduced flecainide. I was still, for the next month, for the next year and a half, I had many checks at St George's to check that I was on the right pathway. And I am pleased to say that I am now stable on the magic combination of tablets. Because they found a positive genetic result for me in March, the priority shifted of who to be tested next, and my children became the top priority. I have 3 children, and at the time they were 13, 16 and 18. So they had to be referred. I had to write to my GP to back up the referral, and they got referred first to St Guy's, but then to St George's, where in May they got tested. We were lucky enough to be offered excellent counselling, because they wouldn't proceed with the genetic test until the children fully understood what was involved. And because of my history, this potentially could have been really frightening for the children. So it was dealt with to explain that my pathway with the condition is different from someone else who might be controlled before they start to show symptoms of it. All 3 children agreed to be tested, and a month later they got their results. The boys were negative, although there's a 50-50 chance of any of the children getting it, and my daughter was found to be positive, and she carries the same familial gene, which is RY R2 mutation. The Royal Brompton offered her tests, so she had to go for an exercise tolerance test. She went there because of her age, because at the time St George's only dealt with adults or teenagers over 16. And she's pleased to be under the guidance of the Royal Brompton. When we went there in June, she had her exercise tolerance test and they found the same dangerous heart rhythm. She was immediately put on medicine. She started on flecainide and then they introduced nadolol to her later. And she is now on a balance that is proving to be successful and can carry on living life as a regular teenager. They've put a care package in at school so that she can be looked after, and the advice is that everyone involved in her care has to know CPR and know where the defibrillators are on site. So I have to be careful that I don't overmother her, because you have to live a life as well as have a condition, as we've all discovered. So that's good news. I genuinely believe that the genetic test has saved her life. It's taken a long time for the rest of my family to get tested, but I'm pleased to say they have been tested now. My parents do not have the RYR2 mutation, but my sister shares it. She has now had a pacemaker fitted and is on the same medicine, but has been asymptomatic. She hasn't suffered any symptoms whatsoever, so that's good. My brother is fine, but it doesn't necessarily affect females more than males. Maybe we have stronger genes in our family or something. You'll know more about that as experts. So it's been a lifesaver to get genetically tested, and that's why I wanted to come on here today. I genuinely believe that I want to encourage more GPs, nurses and consultants to learn about the potential. When I first came out of hospital, they didn't know what was wrong with me. They haven't known what was wrong with me for the last nearly 30 years. And I was on medication to stop my heart acting erratically, but the drugs made me feel like an old woman. I felt terrible and couldn't do any of the things I used to. The genetic result has meant that I'm now on the correct medicine and I feel much more like me, so I can get on with life. Although I do have some restrictions. Sadly, I can't be the adrenaline junkie I used to be. And I can't do as much physical exercise as I like to. So I'm having to find my way to the new Liz, but I'm very, very grateful I'm here, and I'd like to say thank you so much to everyone who's been involved in my care. I'm indebted to every single one of you. I think I've run out of words. I've probably gabbled a bit quick. So, are there any? Yeah. Over to you, Sarah. Sara.
Many thanks. What a story, eh? Amazing. And that is a really, really rare condition that Liz has, and a very rare genetic mutation. So
to say that it only affects 1 in 10,000 people, as opposed to something like long QT syndrome, which is 1 in 1,000. So yeah, it's been a struggle for GPs to accept the condition because they've never heard of it. Or if I go to, unfortunately, I've had a few trips to A&E, because if I have any heart pains, that's where I get sent straight away. And sometimes they haven't heard of it. Dr. Speckman, who's a chief consultant at St George's, who teaches about genetics, thinks it's a good thing if people ask questions, because it means more people will learn more about it. But it's sometimes a bit unnerving as a patient.
Oops, Daisy, sorry. From our experiences, we have massive gratitude, but there are questions that remain. For me, my letter was very brief. It was only when I went to the Royal Brompton Laboratory and met Matt and his wonderful team that I was able to see the complexity of what had gone on, and found out that I think the dilated cardiomyopathy panel has something like 48 genes looked at, because my concern was that had they done things properly, had they checked everything, because everything was so brief. With Liz's letter, they actually said that the number of genes that had been looked at. So in terms of selling yourself and all the wonderful work you do, I would, as a patient, say, why not give more information from the genetic test for the patients, but also for the medics. In both our cases, shouldn't the genetic test have happened sooner? I mean, with Liz's experiences, having been ill for so long, it was a shame that it took a cardiac arrest where the heart just stops working, the muscles stop working. We haven't explained the difference between a heart attack and a cardiac arrest. And we both found many people not understanding the difference, including people in the medical world, that a heart attack happens where something blocks the flow of blood through the body. And there are signs, and you can take action to sort of help things. With a cardiac arrest, the muscle stops pumping. So things are even more dangerous, and action has to be taken even more quickly. So the genetic test, could it have happened sooner? For me, I still don't know what caused, and nobody knows what caused my cardiac arrest and my dilated cardiomyopathy. So if it's a virus, how come I wasn't ill? I don't know. Big things. The waiting time between the blood test being taken and the results. Liz, did you get any updates on your test?
No, I just had a radio silence until the result. And because it was sort of, 2021, I got a phone call from Dr. Spectorman, and luckily that happened while I was on public transport. So luckily, the ICC cardiac nurse, she phoned me up later in the day when I was at home, and just talked through the whole thing of what the condition was and everything. But it did take a while for it to sink in. From my family's point of view, it was hardest to get my parents and siblings tested after the delay and the initial impetus from St George's, because GPs weren't familiar with it, and my sister's under a hospital near Eastbourne, and her heart consultant has had to go on specialist training about the condition. So it'd be, you can't learn about it all, but it'd be fabulous if people learned a bit more about them.
Yeah. And in this day where if you order something on Amazon, you can get updates about, whether it has left the depot, whether it's out for delivery. So surely more information, giving updates would be handy. Just an update to say it has been received at Guy's would be useful, because I got a lot of anxiety while waiting for me for my result. I also wonder, will there ever be a time when my DNA is retested after the negative result? Might there in the future be more discoveries about genetic links? So will that happen? How does it happen? Do I push for it? Will somebody be on the case? And persuading relatives to have even cardiac screening, let alone genetic testing, was quite a big deal. People not thinking that they needed to do it, but also worried about the consequences. So my daughter, during the time that I was being genetically having my genetic test looked at, she was buying her first property, and so for about 5 months she was without life insurance because she didn't want to take it out when she had the risk of a genetic issue coming out. So those were issues for us.
I was told to be completely confidential. So maybe you should have had that too, and then that would have helped that situation, so it wouldn't affect things like life insurance unless you personally said. And it hasn't affected mine actually, even with the condition, because it's being looked after, managed.
That's good. So just in conclusion, we have massive gratitude. Those were sweet peas from my garden last year, just for you. Big thank you to all NHS staff, especially the ambulance services and the hospitals that we were looked after at. And a big call out and thank you to Katie Frampton and Liz Wilson in the inherited cardiac conditions and all their colleagues in their teams, and the charities that have been very helpful for us. The charity Sudden Cardiac Arrest is how we've met, and it's a great support talking to somebody else who's had a cardiac arrest. There aren't many of us around, remembering that 92% don't make it, and I've had a lot of help from the Cardiomyopathy UK charity for my dilated cardiomyopathy. So big thanks to all of you super scientists, technicians, staff, everybody. So now, any questions?
Thank you very, very much, both of you. Yeah, please, questions, put your virtual hand up or put them in the chat. What an excellent talk that was. Thank you so much. This is such a great insight for us. A lot of us working in the labs, whether scientists or technical team members, we hardly ever get to see the patient side. We hardly ever get to actually see patients as well. So this is such a valuable contribution to all of us. So thank you very, very much for taking the time to do this, and especially sharing such personal information with us, which I can't even imagine how difficult it will have been. And also thank you for highlighting the importance of the roles of the genetics departments, whether that's our genomic laboratory hubs, but also the GMSA, the Genomic Medicine Service Alliances, who, they're heavily involved in communicating and educating the non-scientific workforce as well, as you mentioned, Liz, with Tuti as well. So, yeah, just a massive thank you from our side, and we'll move on to any questions we might have. Topku, you want to unmute and ask your question? you. I think Topku, have you got a question for us? Your hand is up. You need to unmute your microphone if so. Have we got any other questions? I can't actually see any in the chat at the moment.
Miranda's just posted one.
Yeah. So, yeah, I don't know if you can see, I'll read it out from Miranda. With being a second generation immigrant, has this been taken into account in terms of info?
Hi, Miranda. My daughter's called Miranda. I don't know what you mean.
So I'll just take myself off mute. What I mean is, in other countries, like my parents are from Ghana, and their sort of health system isn't as